Hello everybody, my name is Sanjeev Jain and I work at Columbia Asthma and Allergy Clinic. I have been asked by my team as well as my patients to talk about the COVID-19 pandemic. I'm no expert at this condition, but I will provide my perspective as a physician. As you know, this condition is caused by a coronavirus, and it is quite similar to the SARS virus that caused a significant outbreak in China back in 2003. This condition is different. Even though these two viruses have 96% homology, they behave quite differently. The current virus has 1,000 times as much virus that is released by patients who are infected by it, and it also sheds from your body for a much longer period of time. In particular, what is most concerning is that it is shedding even when the patient does not have any symptoms, and those are the things which have made it much more dangerous as a virus compared to the previous virus. And this is part of the reason we're seeing a global pandemic emerging from this particular virus. As you know, the world has taken unprecedented efforts in trying to curb the infection and its spread, and the question becomes why? We have seen pandemics before, but such extreme measures were not taken previously, and the answer to that lies in the fact that if we don't do anything, the world has not seen this particular virus before. And so the end game is going to be that essentially everybody is going to get infected. And even though 80% of people who get infected do not have significant illness from it, but the other 20% do have illness, and approximately 2 to 5%, depending on the region, are actually dying from this condition. So if we were to just look at the population in America with 300 plus million people, if 2% were to die, that is 6 million population. And of course, that would be a devastating consequence for the country. And furthermore, we will not have the medical facilities and manpower to treat all the patients who will require treatment. And we've seen that happen in New York City in particular, and that can happen pretty much in every single city in the US, and that is the reason we had to take unprecedented efforts in order to control this condition. Now, in previous pandemics, such as the 1918 Spanish flu epidemic, we did not know as much as we know now in terms of how to control these outbreaks. And even at that time, the evidence became very clear. That was the evidence of Philadelphia versus St. Louis. In Philadelphia, the measures to curb the infection were taken just a few days after the outbreak started. And the net effect was that many more people died in Philadelphia than they did in St. Louis. And we see a similar effect even today. For example, between San Francisco and Los Angeles, the shelter-in-place order went into effect in Los Angeles about 5 days after San Francisco, and Los Angeles has had many more casualties compared to San Francisco. And so those are the consequences of delay in implementing the social distancing and shelter-in-place actions. The question then becomes how do we go forward from this point? And that is a challenging question. The reason being, the virus is still out there. For anybody to think that this virus is just suddenly going to go away is simply not going to happen. The Spanish flu virus is still with us 100 years later. HIV, which was a major pandemic that began in the mid-80s, is still with us. The last major pandemic we faced was the swine flu, or H1N1 virus, and that virus is still with us. So once these viruses spread throughout the world like this particular virus has, eradicating and totally getting rid of this virus is simply not easy. It has been done. One example of that is smallpox and polio, and those viruses were eradicated from the face of this earth, but that required heroic efforts by thousands of healthcare workers throughout the world for decades before those eradications happened. And so the same level of effort will be required to ultimately eradicate this virus from this world. The only question for us at this point is, how do we mitigate the negative impact of this virus, not only from a health perspective, but also from an economic perspective? And we have, of course, lived with many chronic infectious diseases for centuries, and we will just have to learn with this new virus that is going to be around us for a long time. And the way we have to manage this is through implementation of proper protocols and procedures to minimize the spread of this virus, and also come up with strategies of treating this virus. Since the time of Black Plague, humanity has been able to survive all these pandemics only through two ways. One is reducing the transmission. Second is generating immunity. And when it came to Black Plague, the way to reduce the transmission was to get rid of the mice and rats, and also get rid of fleas. When it comes to COVID-19, it is being transmitted through the respiratory pathway, and for that reason this is something we will just have to get used to, which is to maintain social distance as much as possible. And so these guidelines of trying to stay at a distance of close to 6 feet from others as much as possible in public places is something that we will just have to adopt as a way of life for the foreseeable future. The same thing will be required in terms of person-to-person contact. Of course, handshakes is something that's part of our tradition for a long time, but we will just have to get used to greeting people without shaking their hands. We will also have to learn to clean our workspace in public places or in our employment places in such a way that we minimize our risk of acquiring the infection. So all those changes we will have to make in our day-to-day life. However, we cannot be as strict as we have been over the last few weeks. And I want to emphasize that there is a difference between our goals in the last few weeks and what our goals will be moving forward. So let us take the scenario where, let's say, 1,000 people in any one town are infected with the virus at any one point. Now that is a number that is too high. At that number, we cannot track every single person who has the infection and who that person's contacts are. And so in that situation, our first goal is always to really reduce that number down. So the goal is here to flatten the curve. As people talk about, the purpose of flattening the curve is to reduce the number of people with infections such that our healthcare system is not overwhelmed. But in addition, what we have to do is bring the number down at a level where we can then have the public health officials able to manage the number of people who have the infection. And the way that is done is basically by tracking every single person who has the infection. Taiwan, for example, has done this very effectively. And what they have been able to do is utilize cell phone data, surveillance camera data to track every single contact of every individual who had the infection. And once sufficient testing capabilities established, then we have the ability to test every single contact of every index patient who has this infection. And in Taiwan, for example, for each index patient, 300 other people needed to be tracked and their infection status needed to be established. And then whosoever is found to be infected, then you go to those individuals and figure out who their contacts have been and make sure that they also don't have the infection. And so that's the process that one has to use moving forward. And so the public health system has to gear up to do the level of surveillance that will be required in the near future to contain this infection. And again, our goal here at this point is only to contain. Eradication is simply not a very practical possibility for now. Now, in the coming years, we're going to see new drugs develop. We're also going to see, hopefully, vaccine develop, and those are going to be the real game changer in the next few years, who will allow us to lead a more typical, normal life that we have been accustomed to in the past without having to worry about spreading this virus. And that will happen. I'm very optimistic that in the next year or two, those advances will happen. Our pharmaceutical industry is much more capable of developing new drugs than it was 20, 30 years ago. And I remember the HIV epidemic in the 80s and 90s, and initially whatever drugs which were tried, such as AZT, they sort of worked, but they were not the best drugs. They were not the ones that were able to ultimately get this infection under control, at least in the US. The current medications that have been tried are likely to be partially effective, but I'm very confident that in the next couple of years we will see new drugs develop as well. And when it comes to vaccine development, again, the technology today is much more advanced than it was just a few years ago, and I'm very confident that a new vaccine will develop. But again, we can't be 100% sure of that. Again, 35 years later, we still don't have a vaccine for HIV. Now, HIV is a different disease, and for that reason, it's difficult to develop a vaccine for that. But the last major pandemic we had, namely swine flu or the H1N1 virus, now that pandemic fortunately was contained much faster, and the reason for that was it was similar to the common flu that we knew how to make vaccines for that, and the population had existing immunity for other flu viruses. So for that reason, developing vaccine for the swine flu was a much easier task in some ways. I am overall pleased with the statistics as they're emerging in the West Coast within the last week or so. I think we are definitely seeing that the curve is flattening, and actually there may be somewhat of a decline in the number of new cases as well. And so these are all very positive trends, and one can attribute that to all the shelter-in-place orders and all the effort that people have made. Initially, when all the mathematical modeling was done, it was assumed that in America, achieving better than 50% compliance of these orders is not going to be practical. But we have clearly demonstrated that when we're asked to do something so important, that we rise up to that occasion. And more than 90% people have actually followed those ordinances very carefully. And so we're seeing the effect of that, and I hope that in the next couple of weeks, many of these restrictions will be gradually lifted. And we as a company need to be thinking about how life is going to be like when we open up all the services that we have been offering for all those years. How will that look like? And we as a company are very actively thinking about and planning for how we're going to move forward. And some of the changes we have made are actually positive changes, and I think they're probably going to stay to some extent. For example, telemedicine. I think telemedicine is here to stay. It is just a convenient way of communicating and also having appointments if no procedures are being performed. And so I'm hoping that we will be doing a lot more telemedicine for the foreseeable future, even after many of these restrictions are lifted. The other changes that we had made was all our short patients were through appointments only, and we took away walk-in appointments during this crisis, and I think that's another change that most of our patients are actually very satisfied with, because the wait times are shorter and they get their treatment much faster in some ways. And so we're going to have changes, and our office will definitely be contacting you and communicating with you to let you know when we can start doing some of the procedures such as oral immunotherapy, such as skin testing, and other types of treatments and procedures that we have put on hold for the last couple of weeks, hopefully we will start performing all those procedures in the very near future. And I remain overall very optimistic about this new world reality that we're faced with. It is definitely a major challenge, but life will be fine, and we will continue to provide the services that we have been providing in the next few weeks as we gradually open up our services as we move forward. Thank you very much for taking the time to listen to this talk, and please let me know if you have any questions about any of what I talked about. I can have another talk in the next week or two to answer all your questions. Thank you again. Thank you very much for your support.